ಪ್ರಮೀಳಾ ಅಂತ. ಇದು ನಮ್ಮ ಅಪ್ಪ ವಿಜಯ್. ನಾವು ಮಡಿಕೇರಿ ಕೊಡಗಿನಿಂದ ಬರ್ತಾ ಇರೋದು. ಅಪ್ಪನಿಗೆ ಒಂದು ವರ್ಷದ ಹತ್ರ ಆಯಿತು ಕೈ ನೋವು, ಜಾಯಿಂಟ್ ಹತ್ರ ಎಲ್ಲ ಪೇಯ್ನ್ ಬರ್ತಾ ಇತ್ತು. ತುಂಬ ಡಾಕ್ಟರ್ ಹತ್ರ ಎಲ್ಲ ಹೋಗಿಬಿಟ್ಟು ನಾವು ಮೆಡಿಷನ್ ಅದೆಲ್ಲ ತಗೊಂಡು, ಆದರೆ ಕಮ್ಮಿ ಆಗ್ತಿರ್ಲಿಲ್ಲ. ಮಧ್ಯ ಫೀವರ್ ಅದೆಲ್ಲ ಬರ್ತಿತ್ತು. ಲಾಸ್ಟಿಗೆ ನನ್ನ ನಾದಿನಿದು ಫ್ರೆಂಡ್ ಒಬ್ಬರು ಇಲ್ಲಿ KMC ಅಲ್ಲಿ ಡಾಕ್ಟ್ರ್ ಇದ್ದಾರೆ, ನರದ ಡಾಕ್ಟ್ರಿಗೆ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಬಂದಿರೋದು ನಾವು ಇಲ್ಲಿ. ಅವಾಗ ನರ ಡಾಕ್ಟ್ರಿಗೆ ತೋರಿಸೋತ್ತಿಗೆ ಅವರು ಹಾಗೆ ಡಾಕ್ಟರ್ ಸುಮಂತ್ ಡಾಕ್ಟ್ರಿಗೆ ತೋರಿಸ್ಲಿಕ್ಕೆ ಹೇಳಿದರು, ವಾತದ ಡಾಕ್ಟ್ರು ಅಂತೇಳಿ. ಹಂಗೆ ಅವ್ರಿಗೆ ತೋರಿಸಿದ ಮೇಲೆ ಅವರು ಅಪ್ಪನ್ನೆಲ್ಲ ಟೆಸ್ಟ್ ಎಲ್ಲ ಚೆನ್ನಾಗಿ ಮಾಡಿ 1 ತಿಂಗಳಿಗಿರೋ ಮೆಡಿಷನ್ ಕೊಟ್ಟರು. ಆ ಮೆಡಿಷನಲ್ಲಿ ಸ್ಟಾರ್ಟಿಂಗು 1 ವೀಕೆಲ್ಲ ಪೇಯ್ನು ಹಂಗೆ ಇತ್ತು. ಮತ್ತು ಮೆಡಿಷನ್ ಇದಾದಂಗೆ ತಗೊಂಡಂಗೆ ಪೇಯ್ನ್ ಕಮ್ಮಿ ಆಯಿತು. ಮತ್ತು 1 ಮಂತ್ ಕಳೆದು ಪುನಃ ನಾವು ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಪುನಃ ಚೆಕಪ್ಪಿಗೆ ಅಂತ ಬಂದು ನೆಕ್ಸ್ಟ್ ಅದೇ ತಗೊಂಡು ಫೀವರ್ ಬಂದ ಟೈಮಲ್ಲಿ ಮೆಡಿಷನ್ ತಗೊಂಡಿರಲಿಲ್ಲ, ಸ್ಟಾಪ್ ಮಾಡಿದ್ದು. ಆವಾಗ ಪುನಃ ಜಾಸ್ತಿ ಆಯಿತು. ಮೆಡಿಷನ್ ಸ್ಟಾಪ್ ಮಾಡಬಾರ್ದು ಅಂತ ಹೇಳಿದರು, ಬಟ್ ಮೆಡಿಷನ್ ಸ್ಟಾಪ್ ಮಾಡಿದಾಗ ಸ್ವಲ್ಪ ಪೇಯ್ನ್ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಆಯಿತು. ಮತ್ತು ಪುನಃ ರಿಪೀಟ್ ಅವಾಗೆ 3 ತಿಂಗಳೇನೋ ಈ ಕಡೆ ಬಂದು ಆವಾಗ ಇಂಜೆಕ್ಷನ್ ಎಲ್ಲ ಅವ್ರ ಕೈ ಸ್ವಲ್ಪ ದಪ್ಪ ಮಡಗಿತ್ತು, ಇಂಜೆಕ್ಷನ್ ಚುಚ್ಚಿ ಅದರಿಂದ ನೀರು ತೆಗೆದ್ರು. ಈಗ ಜಾಯಿಂಟ್ ಎಲ್ಲ ಕಾಲ್ದು ಕೈ ಜಾಯಿಂಟ್ ಎಲ್ಲ ಪೇಯ್ನ್ ಕಮ್ಮಿ ಇದೆ. ಬೆರಳಲ್ಲಿರೋ ಜಾಯಿಂಟ್ ಅಲ್ಲೆಲ್ಲ ದಪ್ಪ ಬಂದಿತ್ತು. ಒಂದು ಗ್ಲಾಸ್ ಹಿಡಿಯೋಕ್ಕಾಗ್ತಿರ್ಲಿಲ್ಲ, ಬ್ರಷ್ ಮಾಡ್ಲಿಕ್ಕಾಗ್ತಿರ್ಲಿಲ್ಲ. ಹಂಗೆ ತುಂಬ ಪೇಯ್ನ್ ಬರ್ತಿತ್ತು ಬೆಳಿಗ್ಗೆ ಅದೆಲ್ಲ. ಲಾಸ್ಟಿಗೆ ಇವಾಗ ಅದರದ್ದೆಲ್ಲ ಇಂಪ್ರೂವ್ ಆಗಿದೆ. ಈಗ ಅವರು ವರ್ಕಿಗೆಲ್ಲ ಹೋಗ್ತಾ ಇದ್ದಾರೆ, ಆದರೂ ಸ್ವಲ್ಪ ಒಂದು ಜಾಯಿಂಟ್ ಹತ್ರ ಸ್ವಲ್ಪ ಪೇಯ್ನ್ ಇದೆ ಅಷ್ಟೇ.
So this elderly man presented with multiple joint pains which was deforming, and it involved all his large and small joints of his hand as well as his feet. We initially started him on systemic therapy, and with systemic tablets for around a month he was doing fine, but he developed a right wrist joint arthritis and it was debilitating. He was unable to do his work. He works in the farm and he was totally unable to do it at all since it was affecting his right hand. Now at this point, since he was an elderly male, I did not want to escalate systemic therapy and I wanted to direct my treatment particularly at the affected joint. And in this case, I chose to do we chose to do an ultrasound-guided injection of the wrist joint.
As Dr. Sumant referred me to my department, so what I could see in this elderly male was a lot of inflammation, which is acute in background of chronic changes. At this point, what we went is ultrasound-guided injection of the right wrist. As Dr. Sumant referred me to our department, this elderly patient had acute inflammation in background of chronic changes. He had little bit of deformed wrist at this point of time, so ultrasound-guided was the best option at this point of time. Why? Because we wanted to go inside the joint space and give it at the inflammation side. So I injected him steroid in equal amounts and local anesthesia. I just wanted him to have a fair assessment at that point of time. So he had a better movement, mobility and reduced pain immediately after injection. So on imaging, we moderate the right amount of steroid dose for that particular joint. We just don't give the joint. With what is required, we just give in the small doses and under supervision and under guidance.
So a lot of times patients present with inflammatory diseases affecting a single joint, in which case giving escalating systemic therapy like systemic steroids would actually cause more harm. In that situation, we give steroids directly into the joint, eliminating the risk of systemic adverse effects of the steroids.
So usually we get daily multiple consultations from all departments. At the end of the day, it's a teamwork. So what they see in clinical, what we see in imaging should correlate at the end of the day. So what we as a radiologist, you can always see whether the condition of the joint is it acute or is it a chronic. Will the steroid help or not? We will be able to justify that point of time. So with the multidisciplinary approach, with appropriate laboratory, clinical as well as patient's condition, we can inject the steroid as well as other treatment modalities into the joint, help them.
A lot of times we are faced with the clinical problem of whether the joint that we are seeing that is swollen, is it infective, is it inflammatory, or is it just degeneration. And at this point, a more accurate diagnosis can be achieved using the radiologist's help and with imaging. Further to this, if we are not able to deliver medications in a systemic fashion, we can deliver the medications within the joint itself in a very accurate way.
As said by sir, We have always get the clinical input and we get a laboratory input when the patient comes to our department. So we'll have a relatively better knowledge whether it is an infective, inflammatory or a mechanical problem to the joint. So after seeing that, we can, with the help of teamwork and under supervision, we can always inject or we can tell them the further modalities, what they can do for the joint and help them recover at the earliest.